we know our good friend, Dr. Tom Levy, JD, MD, he said, all chronic degenerative diseases feature increased extracellular and intracellular levels of calcium. The increased intracellular calcium also results in increased intracellular oxidative stress. Big statements. And we know that, the functions of calcium ions in our body are multiple, and it's the most important mineral and the most abundant mineral in our body. 85% of all the minerals in our body is calcium, 85%. And so what we need to remember here, and you'll hear it over and over, is that dysfunction of calcium signaling causes our cells to dysfunction. When we're talking about ionic calcium, it's the subject today, we can and we should provide this calcium to all types of cancer because we're going to get a metabolic autonomic nervous system balance, I should say, in sympathetic and parasympathetic. What we really are working on is information pathways, the signaling, so that the cells can do what the cells need to do. Here was published about subtle dysregulations of calcium ion signals have been linked to major diseases such as cardiovascular diseases, bipolar diseases, schizophrenia, and Alzheimer's. With respect to mitochondria and calcium ion bioregulation, we know that excessive calcium ion concentration inside the mitochondria produces ROS, free radicals, that damages DNA, RNA, and proteins. And this damaged mitochondria upregulates fermentation-based biochemical processes that generate lactic acid. And we know that's one of the big theories of cancer and carcinogenesis, right? So what we want to do is we want to restore calcium bioregulation, because by doing this, we reverse that damage and normalize metabolism. So we're really triggering physiological responses by providing ionic calcium supplementation. Here we see this was data from a collaborative clinical work with the Calcium and Bone Health Institute and the University of Arkansas Medical School in the U.S. And to get to the bottom of this on the right, restoring calcium balance, typically there's elevated serum calcium ions, the pituitary gland releases a TSH, thyroid releases calcitonin, we have an increased bone turnover, and then there's a body-wide decalcification, and we're storing calcium balance. And of course, that's what we need. Remember, at the cell level, then it's transferred to the tissue, and also then to the organs. And remember, once we're doing this, we're enhancing that cell function, and we're getting better oxygenation at the cell level. We're getting better detoxification at the cell level. So these calcium ion signaling is providing ideal cellular health. So when I first looked at this slide, I thought, wow, this is a magic bullet. And we say, hey, how could anything, help all these pathologies? But it's not about that this is going to reverse autoimmune diseases or mitral valve prolapse or Meniere's. It's just that it's providing that signaling pathway so that physiological pathways happen in the body, and then health improves. Isn't health kind of simple, right? It's sometimes we make it too complex. And here's a magnification of the effects of decalcification of AIC therapy. I have my radiologist, interventional radiologist, look at this because I wanted to make sure that I'm presenting something to you, that was vetted a few times by radiologists. And this is kind of unique because my biological dentist friends, they say that reestablishing and rebuilding vertical bone in the jaw is very complex. And it's one of the challenges for biological dentists. It gives them more gray hair. The horizontal bone growth is not that difficult. And we see with AIC that it helps restore and maintain your oral health, create strong jaw bones to support the teeth, great for patients undergoing dental transplant and or implants, and significantly promotes the formation of cementin. And in those images you see there from day 1 to 10 months later, there's a significant increase in bone mineral density in that bone that where a tooth was extracted. Here's, something else, kind of the same story. This was osteoporosis induced by steroid use, and the same thing in a relatively short amount of time, the patient had good callus formation and no evidence of fracture. So here are 3 case studies. One is a patient with multiple myeloma. And this patient, 80 years of age, she was diagnosed in 2012, and she has been in remission. She was followed for 5 years. 2017 was the last time she was contacted, and she was treated after failing conventional therapy. She was treated with AIC. And here it's showing you what's happening with platelets, WBCs, and neutrophils. This is not one of our Hope for Cancer patients. This was a patient provided by the AIC group. And then individually, we could see the white blood cells, increasing throughout time, neutrophil, platelet increase, and then on the bottom right, we see the bone density and the GFR increase in this patient, going from a T score of minus 3.6, truly osteoporosis, to minus 0.9. And at 80 years of age, right? So that's significant. This is a stage 4 lymphoma patient, and all of her symptoms improved when she started what is considered the therapeutic dose of AIC is 5 mLs and 500 mLs of water 4 times a day. For prevention, we could do 5 mLs and 500 milliliters of water once a day. We had a patient recently at Hope for Cancer in Cancun that had a renal cell carcinoma, and he had Parkinson as well. And he came with his son, who's a rehab physical therapy guy. And about a week and a half later, in consult, the son said, Dr. Tony, my father is walking better on the beach. And to walk on the sand with Parkinson is not very easy. And so we weren't treating the Parkinson, the renal carcinoma was a big issue, but he improved with the Parkinson too. And then the more I looked at him, I saw that his tremors were better, his speech was clearer, and his gait was much improved. So that was, once you see it, and sometimes it speaks better than all this information. And this is one of our patients, carcinoma of the right breast. This was a triple-negative breast cancer, also an 80-year-old patient, extensive metastasis to bone. Then in July 2018, she was diagnosed with carcinoma of the right breast and mets to the bones, T9, T12, and the rib cage. Here are some of the images that you can see. Improvement on CT scan, reduction of that lytic lesion. This is the T10. And here you see involvement in T12, L2, and L5. And the T12 was smaller, no evidence of the lesion in the L2, and positive response in the L5. So here we see the 2 lytic lesions in the vertebral body. And almost a year later, no evidence of disease, right? Now we look at the sacrum, the same very good response as you see there.